Introducing Cardioreport, the Cvis supporting our cath lab managed services to deliver best-in-class results. We knew that an effective information system to support and manage processes was essential to improving patient care. Currently, hospitals rely on many independent systems, but systems aren't often integrated, creating extra work and increasing the risk of delays and errors. Redundant administrative tasks in particular are a burden and take valuable time away from patients. Cardioreport is a comprehensive and clinically focused information system that centralizes and integrates all the information you need to run your cath lab, from patient information and related diagnostic images to the clinical data points required for any cardiovascular procedure, even the inventory on the shelves. Designed by and continuously updated at the advice of practicing cardiologists, Cardioreport is purpose-built to meet the specific needs of cardiology departments to achieve efficient and safe practice. It has a modular and flexible design that's easy to stage and implement, and once in place, it smoothly fills the gap between the hospital information system, the radiology information system, and other modality-specific systems. The suite covers all cardiovascular care, inpatient or outpatient, invasive or non-invasive, for simple and complex procedures. A user-friendly interface and graphical documentation make it easy for everyone to use. Let's follow John, who is scheduled for a coronary catheterization, to see how Cardioreport's workflow-orientated modules help a team run an organized, efficient lab. The secretary used the web-based scheduler module to add John to the system, quickly completing predefined fields specific to the procedure. Scheduler interfaces with the hospital's information system, simplifying the scheduling process and making advanced planning easy and flexible. John arrives and is pleased to find out that the lab is running on schedule. Once John is ready to be moved, the nurse requests a porter to transport him from the ward to the lab. The porter then confirms via a smartphone app that he has picked up John. Via the boarding vision, the attending physician and technician see that John is in transit and start getting ready for the procedure. The boarding vision allows staff to see patient status and location and simplifies communication between the labs, coronary care unit and wards. Boarding vision minimizes the downtime spent waiting for patients. John is brought in and the nurse opens the procedure in Cardioreport and marks his arrival. The boarding vision screen updates automatically, letting everyone know John's procedure is in progress. A drop-down menu allows the nurse to quickly add additional attendees. All products used are barcode scanned during the procedure, and radiography and hemodynamics are managed as usual. At the end of the procedure, the physician has everything he needs to complete the final report. The most current guidelines, protocols, and best practices are all inside, including time-saving tools such as syntax score calculators and graphical fast data entry. He first chooses a pre-loaded template to identify the generic patient anatomy. The drawing appears based on the attributes chosen. He points to the drawing where the lesion was, including its characteristics, and draws the implanted stent. Using the built-in PACS viewer, he reviews the X-ray footage for key images to include in the report, alongside the hemodynamic information and other information from the modalities. No other system makes this extensive clinical knowledge available and easy to use. Once validated with his digital signature, the final report combining all product, drug, event, and image data is automatically generated based on the hospital's predefined template. He saves a copy and can immediately send it to John's referring physician by email. The physician and his colleagues also really like that this data can be simultaneously added to registry or clinical trial databases. Since automating this step, the team now fulfills their data obligations with minimal effort. The robust reporting capability extends beyond procedure-level data. Cardioreport leverages the collected information in a database that enables thorough performance analysis along all dimensions: patient outcomes, operational performance, usage and inventory, and financial, providing a wealth of information for the lab and administrative levels of the hospital. At work behind the scenes is the Tracer module that securely links patient records and inventory management. Tracer allows for more accurate and faster reordering and invoicing, complete traceability of devices, and captures charges for all billable supplies. Now all workflows have systematically and simultaneously taken place in real time, and as John starts his recovery, the team prepares to receive the next patient. We know these improvements take time to realise. We perform an early stage due diligence to stage what we do and when to best fit with your environment and existing programs. To summarise, Cardioreport enhances MedManaged service offering by equipping staff with the necessary tools to address the cath lab's pain points and reduce the workload, enabling them to provide a superior experience for the patients they serve.